The next 15 minutes that you hear on VOB 92.9 FM will be diabetic and pre-diabetic friendly.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
It's Saturday and it's 9 o'clock and you are about to hear 15 of the healthiest 10th anniversary minutes you will hear on your radio, all with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and the Barbados Community Foundation. Good morning and happy Saturday to you. This is Peter the Voice here, and you are about to hear a show that sings the praises, as much as I can sing, of the Maria Holder Diabetes Center. Now, I know that things hard out there, and I might got some people at home saying, I just hear Peter Voice by the radio up on a Saturday morning, talking about this Maria Holder Diabetes Center that located up in Warrens, and I is diabetic, and I would like to go, but I ain't got no money. The few cents that I just work for every week is going to the supermarket and all the money that's be gone. So I would like to attend the diabetes center, but I can't afford it. Maybe I gotta get a sugar daddy. No. There's no need for you to be thinking of getting a sugar daddy, especially the diabetes center wants you to cut back on using so much sugar. You do not need a lot of money to attend the Maria Holder Diabetes Center. They have you covered. All the services that you need, you can get there, all at drastically reduced prices. These services include eye screening for diabetic retinopathy, something you're supposed to do every year once you're diabetic, vascular screening to make sure you don't have what Bajans refer to as bad circulation, and you can also get podiatry services to keep your feet healthy, and also access to diabetes specialists, nurses, and doctors. So like I said before, you get these services at drastically reduced prices, and on top of that, you get a BARP discount. And speaking of BARP, every Tuesday is Priority Health Screening Day for BARP members at the Maria Holder Diabetes Center. Every Tuesday until July the 30th, you get 10% off. Eye screening services that would have been $100, you get for only $90. And you can get, check this package out, a vascular screening and eye screening together, valued at $200 for only $175. So you have got to call and make an appointment, or to get more information, I'm going to give you those numbers now. Get signed up, write it down here. 417-0305 or WhatsApp 243-3937. You should know the numbers by heart by now. You know, we mentioned earlier about how sugar daddies or how too much sugar is not good for you. But there got some people out there that may be saying, so what's wrong with me drinking my sweet sugary drinks? What's wrong with that? Well, let's hear from Miss Victoria Cox. We've been here from she for a long time. Dietitian with the Maria Holder Diabetes Center. She can answer that question for you.
Drinking sugar-sweetened beverages, including soft drinks, juices, beverages made from sugary syrups and such, is associated with unintentional weight gain, increased rate of or increased risk of type 2 diabetes and heart disease, tooth decay and cavities. Really, it's something that you want to avoid as much as possible, especially if you are somebody living with prediabetes or diabetes, because sugary beverages will really spike your blood sugar up higher than you want it to go. And that's, something that we're obviously trying to avoid. As far as how much sugar should we be looking for? Realistically, my answer is going to be if we can avoid sugar entirely in our beverages, that's what we want. You can think of it as every about 4 grams of sugar is about a teaspoon. So when you look at a sweet drink and it's got, 16 grams of sugar, that's at least 4 teaspoons, and it just keeps climbing from there because most sweet drinks are probably at least closer to 25 or 30 grams of sugar for an 8-ounce portion, and that adds up really quickly. It's recommended that, for example, children should have less than 25 grams of sugar in an entire day, and it's about the same for women, a little bit higher for men, but that's total amount of sugar per day, and you could knock that out in one sweet drink alone. So unfortunately, my response is really going to be sugary beverages genuinely are something we want to avoid, in particular if there's any diabetes present, and instead stick mostly to water. You can drink sparkling water or soda water, unsweetened tea beverages. Then there's also the option of artificially sweetened beverages for individuals who want to go the diet route as well. That won't spike blood sugars.
Thank you, Victoria, dietitian from the Maria Holder Diabetes Center. You at home listening, you hear Victoria, right? Stop drinking these sweet drinks. Start using all this sugar. Sugar is not good for you. And sugar daddies are not good for you either. No matter what Captain Sawyer says, sugar daddies are not good. As we go into our song of the day, and as we are inside of the crop over season, inside of crop over city, this is a crop over old one. Captain Sawyer from 2015 with Sugar Daddy. Compliments, the Maria Holder Diabetes Center.
I got kids, school fees for the children, uniforms, go to the supermarket. Captain Sawyer!
Sugar Daddy Sawyer, Sugar Daddy Sawyer, Sugar Daddy, Sugar Daddy, Sugar Daddy Sawyer.
Me and my sugar plum, do what we will never done. Me and my sugar plum, will never done, will never done. Me and my sugar plum, do what we will never done. Me and my sugar plum, will never done, will never done. Something for something, something for something, something for something. My sweet little young thing. Something for something, something for something, something for something. My sweet little young thing. You want a new flat screen? No problem. You want a washing machine? No problem. You got little children? That ain't no problem. Put on your clothes and meet me at the credit union. You want a new stove? No problem. You want new clothes? No problem. You want new hairdo? You want more than me? Well, meet me at the bank at 2:45. Something for something, something for something, something for something. My sweet little young thing. Something for something, something for something, something for something. My sweet little young thing.
Sugar Daddy Sawyer, Sugar Daddy Sawyer, Sugar Daddy, Sugar Daddy, Sugar Daddy Sawyer.
I'm the heavy spender. I don't buy another small fare.
That was Captain Sawyer. As we continue this Saturday morning on the Maria Holder Diabetes Radio Show, we have not focused on eyes recently. And you know eyes important. And you know the Diabetes Center is dedicated to making sure that you do not get any diabetic retinopathy in your eyes. That is why you're supposed to get your eye screened every year. Right now we are going to go to Dr. Charles Pierce, clinical lead in the Barbados Diabetic Eye Screening Program, to tell us about some of the cutting-edge equipment which is available for you when you go to get your eye screened at the Maria Holder Diabetes Center.
So we now have an OCT machine, which stands for optical coherence tomography. And essentially what it does, it creates a 3D image of the retina, which is the back of the eye, and it allows us to see any advanced changes that are happening as a result of diabetic eye disease.
So how is this better than the previous eye screening equipment which you had?
The previous equipment is a retinal camera. It allows us to see if there is any early signs of disease affecting the back of the eye. The new equipment we have is quite similar to an ultrasound machine in that we're able to get more details about what is happening in the retina. So diabetes affects all the blood vessels in the body, and specifically in the eye, it can cause leakage from the very small blood vessels in the eye. And this leakage collects in the center of the eye, the macula, which is responsible for fine detail and can cause OCT machine does is it allows us to see how much fluid is leaking from these blood vessels, and then we can decide whether we need to treat or whether we need to monitor more closely.
What is an eye pressure check, and what's its connection to screening for diabetic retinopathy?
So an eye pressure check is a measurement to see how high the pressure in the eye is. And we find that glaucoma is more common in people with diabetes. So it's important as well to have this measurement, especially in Barbados where glaucoma is so common. So it's another way that we're trying to screen people for eye disease.
Dr. Pierce, if a person is having pressure in the eye, as you were saying, is there any symptoms that a person can tell?
So in most cases, people don't experience any symptoms until really very advanced glaucoma. There's a small proportion of people who may experience pain in the eye or blurred vision or halos around lights, but the vast majority of people would have no symptoms until it's a very advanced case of glaucoma.
The same way that persons must have their eyes screened every year for diabetic retinopathy, is it recommended that they get an eye pressure check every year too as well?
The people who have a family history of glaucoma, so if there's a close relative, mother, father, sister, brother with glaucoma, then you're at increased risk of glaucoma. And especially in those people, we recommend regular checks for elevated eye pressure with an eye care provider. And we've decided to include it as part of our screening process because, as I mentioned before, glaucoma has a higher prevalence in patients who are diabetic.
We now welcome Mr. Victor Atwell, who is better known as popular domino player Mickey. Welcome to the show, Mickey.
Yes, sir.
How long have you had diabetes?
Also, 15 years.
What are the main challenges you would have encountered with the condition?
Diabetes, my main problem I had is diabetes. Very first thing is fasting water.
Mickey, you also had some challenges that caused you to lose your sight. Tell us about those.
My challenge is when I was dealing with a doctor, and then I went to her. She tested me out, give me a test, and then she sent me for another test to make sure that she's right. Or then she told me that the time I can come out and give a morning and able to see up the eye. And that happened in 3 months' time. And then in 3 months' time, they can see up my right eye at all. Nothing at all. Then from that day, so my eye's now gone worse from the 20th of April when I had cerebral palsy. I can't get wrong on my own at all. I wanted to walk, get her all staying in different places. I could just walk around the house, do my little extra walking and that kind of thing. So from the 20th of April now, I handicap now with the cerebral palsy. I can't see nothing. Even if I have money, I might walk it. All I know that I got money, but I don't know how much it is.
Oh dear. So Mickey, considering your experience, what advice would you have for people who might be listening, especially for diabetics, as it relates to having their eyes screened regularly?
Always check your eyes. Your eyes is very important. When you lost your vision, boy, I don't know. I know the vet center do a lot for me. I cannot complain when I went to the vet center to get checked out. I get a good test when I go there. Everything. I get a rear, I get a front shot, my toes on there, and my left for my knee. I get a good test when I go to the vet center. I cannot complain with anybody that's diabetic. Go to the vet center. Go. It's damn proper doctor. When you order the vet center, I would encourage anybody that when you get diabetes or want your eyes checked or anything, to go to Moyne Diabetic Center and get it checked. Your eyes is very important. So that the only place let's go is the vet center and get me checked. I don't know the places.
For over 10 years, the Maria Holder Diabetes Center has been effectively serving the diabetic and pre-diabetic community of Barbados with a range of international standard health services, which include diabetic eye screening, vascular screening, nutritional advice, and consultations with diabetes specialists. So if you are listening to VOB right now and you have a diabetic related query or you need to make an appointment, you can call 243-3937. You can also follow us on Facebook or Instagram. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Center celebrating its 10th anniversary. Until next time,
Drink more water. Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.